Next thing up, the public comment. If you have a public comment, please come up. If there is none, then JD will do an engineer update.
Since Jacob's mic is horrible.
Yeah.
Okay. Is that better?
Good morning. JD King, Bates County Engineer. Fine morning in Bates County. Good working morning. Update was sent out Tuesday afternoon. I'll be brief. Hauling rock and blading roads. The pipe crew is working on slip liners. Yesterday and Tuesday, railroad cars did come in to 260th and the Step Road west to the hospital. But today and tomorrow we're going to be working on the slip liners in anticipation of the contractor to grout those coming in a couple of weeks. We're mowing in the southeast part of the county and still cutting brush around the trees. Winter service for our snowplow trucks continues at the shop. We're still waiting on parts for the other mower. On the construction side, the concrete was placed at the Essex Bridge. We had an RPA meeting to make sure our Grant Bridge north of Essex is in the proper fiscal year, and doing project development work on FM 147. That's the base stabilization for J55. There'll be a title sheet in front of the board next week to keep that on track. An agenda item, if we have time, we'll take a tour of the J Road up in the northeast part of the county. I got the results from our bridge inspection work. They inspected 160 of our bridges this past cycle. There are weight limits that we're going to be posting, there are about 10. No bridges have been closed that weren't closed before.
Good.
So no new bridge closures. We are working on a plan to remove some small bridges and some field entrance bridges that haven't been used, and we'll show that to the board in the next several weeks. The office manager's to an office organization conference in Des Moines. She's District 4 of that. So she'll be back to work Monday. And there's a contract crew going to be doing crack fill on J20 between US 71 and N Avenue. That's 1 mile west of Bethesda. They'll be in tomorrow. And then working next week on J20 and J52 east of Coin. One thing that wasn't annotated on your engineer's update was sometime this month, there's a petition to rock part of K Avenue north of 130th Street. We're working up that petition for the landowners. Got to contact the owners on the other side of the road. Working on that and anticipate that sometime this month. Questions for me about the update?
Where was the crack filling between 71 and what? N?
N Avenue.
Okay.
That's on J20. Okay, thank you.
Oh, thank you.
So the owl's not working on that.
Yeah, I don't know how, the blue light's on, our owl's not working still, so. I wonder if you just turn that laptop around and show the room, turn the camera on, if you do that, I don't know. Technical difficulties here, sorry. If we can't get it to come on, maybe just turn that laptop around with the camera, show the whole room, you know what I mean?
Yeah.
Is there enough cord?
I turned the camera off.
Or turn it on, turn it around, and show the room maybe. That's all I know to do. Just turn it around, so people can see the room. Yeah, there we go. That'll work.
Oh, okay.
Try that. Okay, sorry.
Engineer.
All right, we got some camera, people online can't see the camera from the room, so we're done with that, so now we can go on to our next item on the agenda, number 6. Discussing Page County EMS service as an essential service, and a resolution to go to the vote of the people, so, go ahead.
Good morning, thank you for having us. Thanks for putting this on the agenda. Come talk to you this morning. We've talked to each of you individually about our intentions here with making EMS an essential service in Page County. I'm going to kind of read through here to make sure that I hit all of the items that we want to hit on. The current environment of EMS in Page County, Southwest Iowa, and throughout Iowa and throughout the U.S. Has gotten more and more difficult and costly each year. In recent history in Southwest Iowa, across the state and overall nationally, many of our services have relied on volunteers historically, and we're seeing those services fail and continue to recruit new volunteers and begin to cease providing services. This is for services like Shenandoah Ambulance Service and Clarinda Regional Health Center to cover service areas that are increasing in size due to staffing shortages and delayed response times. Shenandoah Ambulance Service is co-owned 50% by Shenandoah Medical Center and 50% by the City of Shenandoah. Clarinda EMS is owned 100% by Clarinda Regional Health Center. We have 4 volunteer services in Page County: Essex, Coyne, College Springs, and Braddyville. It is extremely important that our paid services, Shenandoah and Clarinda, have 2 crews available at all times, as we frequently have situations where we need to take transfers to Omaha or respond outside the city limits of our respective communities. Whether that be from our facility or neighboring facilities to take those transfers. In fact, we average close to 3 transfers per day between our services, and usually timing of the transfers need to be completed quickly, and oftentimes we're finding that they're simultaneously at the same time, so it's hard to rely on each other to cover each other's crews. On average, a transfer takes 1 crew out of service for a minimum of 3 hours from Shenandoah and longer from Clarinda. It's imperative that we ensure 911 coverage from our service area during the transfer, hence the need for 2 crews, to send 1 crew of 2 people to a higher level of care and to provide the 911 coverage in the city limits and the surrounding area. With the size of the service areas continuing to increase, average 911 volumes have increased to about 7 911 calls per day in the county. That's throughout the whole county that we're responding to. We've seen a tremendous shortage of the EMTs and paramedics in recent years. Like many industries, this has left our services short-staffed, which in turn puts us in a position where it's very difficult to cover our services areas and guarantee timely response times to calls. Currently, hospital-based services all over the state, similar to Shenandoah and Clarinda, are losing north of $500,000 annually. Our services have struggled to recruit individuals to Southwest Iowa in recent years and continue to do so. It's also been hard to justify the replacement of ambulances and other necessary equipment with the services losing so much money. Just for everyone's reference, an ambulance costs at a minimum $250,000, $250,000 for an ambulance. Without new equipment and other shiny things to attract recruits, it makes it very difficult for us to compete for new paramedics with urban services, especially fire departments. Not having full shifts and stable staffing available is not a sustainable plan, and we do not want our patients in all of our surrounding communities to be put in a situation where they are at the mercy of who might be available to take them at a moment's notice if they're faced with a critical medical situation. Most people believe that when they pick up the phone and dial 911, a service is en route on a moment's notice. The truth is that the individual calling 911 is at the mercy of the staffing of the local services. This is exactly why EMS should be declared to be essential service in Page County, and we would ask our Board of Supervisors to help us join 7 other rural counties in Iowa who have already made EMS an essential service. Several others will be voting on these initiatives in counties across the state, including Shelby County and Southwest Iowa. Speaking specifically of Shenandoah Ambulance Service, we typically complete over 900 911 calls and 400 to 500 transfers annually in Shenandoah. Clarinda is very much about the same call volume and transfer volume as we are in Shenandoah. We perform approximately 100 runs per year, or 8.5 per month, to rural residents in Page County. So that's just to the rural areas of Page County. 90 to 100 runs, or 8 per month, to Essex, 50 runs to Coyne, and 50 runs to Fremont County, and outside of Shenandoah city limits to the rural Shenandoah area. Out-of-town calls make up about 30% of our overall 911 call volume. We've begun to auto dispatch with Coyne, Farragut, and Essex due to their difficulty in staffing a volunteer service at all times throughout the day. Many individuals work outside their communities during daytime hours, are not available to respond to calls, especially not in a timely fashion. The bottom line is, let me set this down so I'm not fumbling with it. The bottom line is the design of the insurance, Medicare, Medicaid, well-marked and commercial reimbursement systems for EMS services is unsustainable without significant financial support from entities like the hospitals, cities, and counties, and any donations or anything like that we were to get. While payment for the service provided covers the cost of the EMS call to be performed, reimbursement in no way is close to covering the cost of being available to respond for a call at a moment's notice, 24 hours a day, 7 days a week, 365 days a year. And EMS, the high costs are borne to ensure availability when the emergency happens, much like an emergency room. We do our very best to make sure we're always available to be there to save your lives when you need us. As a service, we are obviously pleased that Iowa legislature is now allowing EMS to be considered an essential service in the state of Iowa. However, that requires support from each individual county's Board of Supervisors to place the decision to make EMS an essential service on the ballot, followed by a 60% supermajority of the public. If approved, Page County would have the ability to levy a tax for EMS services at a maximum rate of 75 cents per $1,000 evaluation. Our current estimate for Page County is that it would provide approximately $647,000 annually in support of EMS. The average homeowner of a home assessed at $200,000 with a homestead exemption receives $100,000 rollback would see an increase in their taxes of about $75 annually, $75 a year. That's it. To provide guaranteed responses in an emergency situation. Our goal through this movement is to provide for long-term sustainability. However, there's no guarantee of success without that. There is no guarantee preserving our long-term ability to respond to all emergencies in our service area, which is a scary position that requires action. The services in Page County have been committed to ensuring our community and the surrounding communities are well taken care of in the event of emergency for the past 40 plus years. Please help us to help us ensure that commitment continues in the foreseeable future. Our recommended path forward from today is publish a notice of public hearing of the Board of Supervisors to consider declaring EMS an essential service in Page County today, October 5th. 2, hold a public hearing to hear all viewpoints on the topic at a regular meeting of the Board of Supervisors with the first hearing on December 7th. 3, County Board of Supervisors votes on a resolution declaring EMS an essential service in Page County at 3 separate meetings, December 7th, December 14th, and December 21st. No earlier than 60 days from the original published notice of the first public hearing. A majority vote of the Board of Supervisors is needed to place the declaration on the ballot. 4, once the resolution has been approved by the Board of Supervisors, a County EMS Advisory Council is formed. The council recommends an amount of funding to be specified on the ballot, no more than 75 cents per 1,000 evaluation. We have developed a draft charter, which has been evaluated and agreed by the 6 EMS agencies in Page County. 5, notice of this imposition of the amount of the EMS tax must be given through the publication no less than 60 days prior to the election. This would need to occur on January 4th. Approval of 60% of the voters at the special election on March 5th would be needed in order to pass. If passed, revenues received by the county from the EMS tax are deposited into the EMS trust fund to be used for EMS and distributed based on the methodology decided by the EMS Advisory Council. Our draft recommendation would ensure $10,000 each be provided to each one of the 6 services in Page County. An additional $10,000 would be deposited in an education fund to fund Page County EMS-wide EMS educational sessions, reimbursement for individuals passing EMT classes, paramedics passing critical care paramedics, and RNs completing the paramedic bridge course and committing to 2 years of service to a Page County EMS service. The remainder of the funds would be divided based on the number of 911 calls and transfers completed for Page County residents. To touch on that just a little bit, it's kind of been discussed and decided throughout the county that equipment and education are kind of the top number 2 items that each service would mostly focus their funds towards if received. Annually moving forward, the EMS Advisory Council must review the needs of the county and provide their assessment to the Board of Supervisors regarding funding needs. The annual report is made public and the Board of Supervisors must hear annual public comment a minimum of 14 days after the date the annual report is filed regarding the request. That's pretty much what I have. Welcome to any questions that the supervisors have.
Well,
Ty, have you guys looked at other counties that have set up they went ahead and voted for the EMS essential services, but then when you guys were setting up your group or your board, was it based off other counties, what they've done?
Yes. So Katie Johnson, who's present here with us today, she has just recently passed law school and passed her boards, so on her way to becoming a successful attorney. So that's great. She's taken the reins on contacting these other counties and kind of getting ideas on how they publicize things, how they approach their board, how they advertised, and spread the word on how they become successful. I believe it was Shelby County, Katie, is that correct? What was the first one? Jones County was very receptive to her, and that's between that county and another county. Pocahontas County were the 2 counties that helped her guide the charter
Oh, okay.
that we put together.
okay. Well, we've all talked to everybody at length about this. I want to make sure everybody understands what's going on. This is to start the process of putting it on the ballot and let people decide.
Yes, sir.
Is what we're talking about here. Whether or not they want to enter into another tax to pay for this. So, and the way you have it broke up, you've decided not to break things up according to 10,000 to each entity and then splitting up ambulance calls. So, I don't know if we have any other discussion on this.
Those numbers, Jacob, those are kind of to get us started. That's
right.
The idea that we have. Once that
The board will
come together and then agree and vote on as a board to make changes as needed throughout to become more successful and make sure the funds are distributed where they're needed throughout the county to each service.
That's your advisory board, not the board.
Yes, the advisory board, right? So,
And then you're still open to not pursuing, like, depending on your advisory board, not pursuing the 75 cents at the start? Or are you pretty much dead set on 75 cents?
We're asking for the 75 cents.
Okay.
That's what we're asking.
Okay.
Again,
At the 75 cents I'm sorry.
it's up to the voters.
It's up to the voters. We're asking for the 75 cents, which previously mentioned will bring us approximately the $647,000. And as mentioned before, each service, Clarinda and Shenandoah are reaching, losing north of $500,000 annually to staff and operate. The $650,000 is or $647,000 is about what we're estimating for the whole county that would go to that advisory council.
So what you're basically wanting us to do is just say, pass a resolution supporting EMS as an essential service,
Yes, sir.
or, yeah.
And then that would go into public hearings. We'd have
Yes.
3 public
Yep.
hearings, and then we'd have to vote on the ballot after the public hearings, after everybody's gave their opinions on it.
Yes.
And then with this March 5th vote, so it's a special election, is that something then that you guys would pay for, or is that something that the county would pay for?
That's something that between Clarinda Hospital and Shenandoah Hospital have agreed to assist us in paying for that.
Okay.
So they're
They're still having trouble hearing.
Yeah, I'm not sure.
Don't know what to do.
My apologies to the online people.
Yeah, it's very loud in here, so.
Yeah.
Yeah, so the cost of the county to even try this on the ballot would be the cost of the election. We're not gonna enter anything there.
No. Sounds like.
You're covering the cost of it, they'll try it.
Yeah, but that's not, right? Yeah.
Is that correct? That's what I thought we talked about in the past. Okay. Well,
I would make a motion that we move forward with this and put a resolution in place supporting EMS as an essential service in Page County.
I will definitely second that.
okay, we got a motion and a second on that. Your discussion? We've all talked a lot with everybody, but I don't know if we've got enough information now. If we're good with discussion, we can vote on it. Okay, I guess we'll vote.
Roll call.
Please?
Holmes,
Yes.
Clark,
Yes.
Maynard.
Yes.
Thank you very much.
Okay, thank you for coming in.
I have a question. Where is this resolution 58? Because the auditor's office has not received a copy of it.
I
Yeah,
have a copy.
We need a Word copy. like
well, we
need a
didn't, the
Word-
resolution, we didn't pass the resolution this morning. I put that, what we're doing is declaring an essential service, basically.
We have to pass the resolution.
You just passed it.
You just passed it.
You just passed it.
Because Tom, that's the motion, Tom.
Yeah, I thought we already had the resolution. Yeah.
That's the wording we have right there. I didn't know that there's 2 steps to this,
Okay.
so
So,
make sure we're clear about what we just did then.
You just passed it. Yes.
so what we're doing is
Well,
saying that we support EMS as an essential service
right.
and to move forward. And I guess I assumed that we were moving forward and then looking at a resolution to back that up. But we already have the resolution?
I never got a copy of the resolution.
Okay.
They sent it out.
So we don't have, this is getting all out of order here. Let's go up here, because the meeting I said yesterday, we are not passing resolutions.
Can I interject?
Yeah, so let's
the-
clear it.
Sorry, the requirement is that you publish notice that the resolution will be considered at their December
It's
7th.
going to be considered.
Okay,
so that's-
okay.
Yep, sorry.
Why there's no resolution.
Okay.
So I make the motion that
Let's
we
just-
consider the resolution at the December 7th meeting.
Yes, that's what
Just
I thought.
reword that.
Let's reword.
December 7th.
I thought
Yes.
that's what you said, basically, so.
Yeah, sorry, no.
It's okay. We'll
Thanks,
figure it out.
Matt.
Yeah, so clear up the wording that has to be said. I mean, is anything cleared up in this
So
resolution?
what do you wanted to say?
Pardon me, so my motion would be that we, set up that on, let's see, on December 7th, we will have a public hearing on the resolution for EMS to become an essential service for Page County.
Yeah, that's what I,
Hearing on December 7th.
Yes.
okay. Because we have to get this resolution out, and that's what we have.
Right.
So what is this resolution?
It's a draft that they've put together, so we're gonna look at it. It's not done yet, I don't think. It's just a draft form. That's why I didn't have it either, until I saw it yesterday morning, so. Anyway, okay, the draft
It
one.
was sent out.
Okay, so
Yeah.
we have the motion.
Is that okay, Kristen? You good?
Move to have a public hearing on December 7th for Page County EMS services as an essential service in Page County.
That's not correct? Okay.
Yep. that'll
Now
be-
get the words right. I thought that's kind of what we were doing, was to clear it up.
Yep.
All right, so we got that words correct. We all voted yes, all want to do it again on that wording? I don't know, I guess we
Sure,
should.
yeah, we better.
Holmes,
Yes.
Clark,
Yes.
Maynard.
Yes.
Okay, got the words correct on that motion. Got that done. Thank you for coming in here.
Thank you. Thanks, Ty.
Okay. All right.
What was that? Somebody's talking.
Don't know.
Somebody online speaking? I didn't hear you.
Okay.
All
well,
right.
Next step on the agenda, we'll do our best here for technical issues, is the wind ordinance on every week as we continue to work on this. I saw the additions
Yep.
put in
Sent that to Carl
that we talked about last week.
and, right.
And this week, thank you guys for coming.
Thank you.
This week, we're considering some issues, like one thing was with the setback from the right of way. I did a little research on that. And things I saw was anywhere from 1.1 to 3 times the height, to half a mile. I saw all kinds of different things. I just need to think about that a little more.
Yeah, because we will have to, we will have to adjust that due to mile sections.
Yeah,
You're almost going to have to be, there's going to have to be some leeway on that.
yeah. As long as they keep.
As long as they're away from non-participating, I think is the biggest thing there.
I was trying to read into that, so if they would throw ice or have shadow flicker, it wouldn't
Yeah.
hit the road, you know.
There was another part in that was about shadow flicker, and they really detailed out what that shadow flicker was limited to 30 minutes per day, I believe, and then so many minutes per year. And what would constitute how they would negate that if it went over. So some of those details are in there. The other thing is the thing that we sent out about the parts being left is that we need to probably talk through what those penalties would be and how would they be enforced. What would be the penalty for leaving stuff out in the field for a certain amount of time? What's that timeline and who enforces that? And what is the penalty? So I think some of those details still need to be pursued and talked through. I would like to see us get to having a completed rough draft in the next 2 weeks or so.
We're getting close.
And try to get that so that we can start at least thinking about when we want to schedule
Have a hearing.
public hearings and things like that.
I think we're getting close. Is there any other topics that we need to address? The right of way is one, I just want to make sure we have it.
Yeah.
We did the lighting. I'm trying to think. If there's anything we've missed, we can go through it. Do you have anything, Peter?
Yeah, I don't think so. But I think that's going to be one thing with the public hearings.
Maybe it'll come up.
I think it'll come up.
But
The
if,
public will have a chance to address things that we might have missed
right, now the
or not thought about.
public hearing, once we start that means we've started it. Like, so
Right.
to go back and change it, we have to.
You have to amend the
So maybe we
ordinance
need to get
or-
this, you'd have to start all over again with at least a new public hearing set, I think. Is that correct? on public hearings. If we start a public
You
hearing.
need to get everything in order before you start your public hearings.
Right,
Okay.
so maybe we get this draft together, then we put it on the website and say, do you have any issues? Come in and tell us something we missed,
Yep.
and then we nail it down, and then we have our hearings. Then we-
Yeah, that would, yeah.
So we need to get the draft done, so the public can come in and give their opinion on it, and then we go to public hearing once we're done.
Right.
Good consensus.
Sounds
So,
good.
so we'll get a draft put together the next couple of weeks, I hope. We're just about done, I don't know how many things to look into, so.
Yep.
If there's no other issues, we'll see about it, anything else next week, and then work towards having to put together the draft, I guess. Okay, so if you have any concerns, or if anybody is listening online, please let us know if there's anything you have concerns about, we'll work on this. Okay, if that's done, we'll board communication, number 8.
I just had an RPA meeting on Tuesday, this last Tuesday, so with JD. And otherwise, it's pretty quiet.
Well, this afternoon's my landfill meeting, about the landfill. And look forward, are you guys gonna be able to go on the tour? Do you have time
Yes.
to do that? Do you have time to go?
Yeah.
Good.
I went to an interagency meeting, which is comprised of the people who provide lots of services to Page County. That was on Tuesday. It used to be called Human Services Council. So it was very interesting.
Was that in Shenandoah or?
No, it's in
What's in Clarendon?
It's always been, yeah.
Yeah.
It's Southwest Iowa Families, Wabansie, Catholic Charities, Ion, Extension, just different ones that provide all of these services. From babies clear up. So yeah.
Okay. All right, we got nothing else, I guess we're on our roads tour here a little bit. We don't have any claims, I don't see any claims. Okay, no claims, so we'll go past 9 to 10 minutes. Let's see here. This. Did you print it out? Did you just read it?
Yeah, I did too. And then I just had a couple, just a few things. First off, there was a couple of typos, and I kind of rewrote those. So on the public comment, it says there no was public comment. So I just switched those 2 words around.
Okay.
And then also 6:09 p.m. was missing the colon or the punctuation mark there between the 6 and the 09. And then I would like to get it to where when we vote on these minutes, it does not have extra wording that says these are rewritten minutes by Mr. Holmes. These are amended minutes by the board and should be stated as such. Nobody's rewriting the whole minutes. It kind of gives a false sense that these minutes have been rewritten completely. We've amended what we have voted on in the past as to what should be in the minutes, and nothing more. Nothing's being added, nothing's being taken out that we haven't voted on. But those are just amended minutes, and that's, one thing that we always have to change on these is we have to take that, the rewritten minutes from Mr. Holmes, or the minutes that Holmes rewrote. I don't think that it kind of adds something to that's not official, I guess. I would say it's not doing us any good by doing it that way.
In Iowa,
Conjecture, I guess, is added, when we do that, so.
Right, and then we've talked about this, I talked about it a couple weeks ago. In code 331, motion wording matter, that's what matters, that's why we just reworded our motion to make sure it's correct a little bit ago. Our motion is never what is in here. and that we're supposed to have our motion worded be correct. So our motion has been to approve the amended minutes. That's the whole motion. And then, so in this last week, or this week, those typos, I saw those, that's right, we had to fix those few little typos. And what we agreed on in February to make things meet Iowa code. So there's nothing being added that I saw this week other than the word amended to fix the motion wording, right?
Right, yeah, we just needed to put amended
Yes.
minutes.
And then we scratched out the words that were not part of our motion. So that's what I did too. So it's not that much different, but it is different what it means. And then Matt meets Iowa code and our motion is correct. So, yes, I agree. So I'm guessing, you look at, see if I did the same thing you did.
We'll swap.
Yeah, Rich. Okay.
Can I get any?
Yes, hold on, sorry. Let me, here's one. It's just on the back page, right? Do you have an extra? I guess you got 2 pages.
Well, no, they're, yeah.
I'll
there's
hand it
just-
over there, I'll check.
Yeah, you can, I
I
just
just see this in a second.
printed out one copy, sorry.
Approve the amended minutes, yep. Todd's here. He's got the typos certainly better than I do, so I think he's look good. So Todd's minutes there, I think. I didn't catch all those typos, so. I thought they were good.
Yep.
So you want to make a motion on yours, or? I think that's it.
Well, I think that you left in your board communication maybe, and I took mine out, but on some of the details.
Let's see here. Oh, yeah.
And see, I left mine.
No.
I took mine out.
No,
so-
that's right, that's right. So I'd make a motion to pass the minutes, the amended minutes, prepared by Todd. No, sorry, I make a motion to pass the amended minutes as presented, and they're the ones that Judy holds, so we'll get them to her.
Yes, I'll second.
Okay. So in discussion on that, we make a motion to pass the amended minutes, that's the whole motion, and we're right there, we're gonna hand them over here in a little bit. When we're done, that's the whole motion.
The amended minutes from Todd.
Well, no, I just want the amended minutes, and they're going to give it to you here in just a second. We can read them if you want.
Do you have a copy for Kristen?
Yes, right there, we're giving those. right
Yeah,
there.
she can have that copy.
These are my copies.
Oh, okay, I just made one copy, sorry.
Okay.
We can make a copy of the,
The minutes, we did not receive the minutes till after 8 o'clock this morning, that's when I saw them on the
Well,
website.
they were-
Solutions is short-staffed, that's where Auditor Wellhausen is today, they're at a budget meeting in Ames.
So this seems silly, but we got these things like
Solutions is
30 minutes
very
ago.
short.
yeah, no, I did see him at like 7:50, so
On the website or where?
on our website, because I kept looking and finally about 7:15 this morning.
They showed up?
7:20, yeah, so they showed up, so they were there a little bit before 8, but,
It's hard to get around for a meeting and get all this done.
yes, but,
Okay, so the motion is to pass the amended minutes, we'll make copies of them. The minutes are made to match what we voted on in February, to leave out discussion or extra comments and meet Iowa code. So that's what we've done, they're right there. And to fix the wording of the motion. So the motion is to pass the amended minutes, which we will give you. All right, can you please have a roll call?
Mayor,
yes.
Clark,
No.
Holmes.
Yes. Okay. Now, so we will make sure that's done right. Do you have anything else on here? We can adjourn.
Make a motion to adjourn.
Motion to adjourn.
Yes.
Second, all in favor, thanks for coming.
Aye.